Hi, my name is Jane Owen. I'm an obstetrician gynecologist. I work at Mount Sinai. I do prenatal care, deliver babies. I do a lot of office GYN and gynecological procedures. So, are there signs of pregnancy before a missed period? I guess my question to really ask the patient would be, are you trying to get pregnant or not? So if someone's trying to get pregnant, they're usually really in tune to their body. They've done some preparation. They're not on birth control or they've stopped taking birth control. And then they come in and they're like, I missed my period or I'm starting to feel a little tired. I think I'm pregnant. So people that are trying to get pregnant will frequently have lots of home pregnancy tests to take. Some of them take them a little too early and they get really nervous. But if someone's on birth control and is not looking to get pregnant and incidentally becomes pregnant, they may notice fatigue, feeling out of sorts. Some people don't have regular cycles, so they don't know when they're pregnant. So it gets kind of tricky. But the usual initial signs are fatigue. Some people feel nauseous. Some people will vomit just, when they're around food that is very odoriferous. So, but initially the primary feeling that a patient will have is fatigue. But patients will come and present with different phases before they find out that they're pregnant. Some do want to be pregnant. Some don't want to be pregnant. Some don't want to be pregnant, but are very happy to be pregnant. So each patient is different. So you should take a home pregnancy test if you're someone that's trying to get pregnant or thinks you're pregnant. It would be about 11 days after conception. So when does a conception occur? Based on your last menstrual period, which would be day 1 of your period, it's very confusing for a lot of people how the menstrual cycle works, but day 1 of your period is the first day you have any bleeding at all. So it's spotting, pink tinged discharge. That's day 1 of your period. So your usual time of ovulation and conception would be in a perfect menstrual cycle, which most people don't have, would usually be around day 14. And so usually after conception, it would be 11 days that you would have a positive pregnancy test. And that's a urine pregnancy test. Now we have much more sensitive blood tests, beta HCG. So that would be positive earlier than that. They're 90% accurate, but some people do have false positives or chemical pregnancies that they can be upset about. I have patients that are, I had a positive test and then I had a period after that. But they're usually very accurate. So a lot of my patients will take a series of pregnancy tests. I've had patients that take 8 pregnancy tests in a row, but they're pretty accurate. Usually we do the urine pregnancy test at home. And there are different kinds, like some make you look at a line, some will say positive. So that, there's a lot of marketing with home pregnancy tests, but it's pretty much the same principle. There the like rings that go around your finger and the watches that tell you when you ovulate, apparently they think they can tell you when you're pregnant. I disagree. But of course, blood pregnancy test is your most accurate. And to kind of go off on a side note, when you're pregnant, early in pregnancy, we still don't know where the pregnancy is, how pregnant you are, what kind of pregnancy you're having, right? So early, like the earlier part of pregnancy is a little more tenuous. It's a little more frightening. So over time, we start to discover a lot more about your pregnancy, but a positive pregnancy test is just the beginning. And then we have to do, a lot of examination to find out exactly what's going on with that pregnancy. But basically, it's urine pregnancy test, different formations of those that you can buy in the drugstore, and then our blood pregnancy tests, which you usually have to go to a doctor for. So routinely, for a normal pregnancy with prenatal care, you want to see your GYN at 7 to 8 weeks. Your initial evaluation will involve an ultrasound. It's usually a transvaginal ultrasound. With this ultrasound, you don't need a full bladder, so you should empty your bladder, and we'll do a urine culture at that visit. But at that visit, we should be able to see a fetal heart rate, look for any problems with the gestation, such as, hematomas, to see if you have twins and whatnot. But some patients like to come earlier if they have any spotting or cramping, which can happen early in pregnancy. But the ideal time to see your OBGYN would be 7 to 8 weeks. here at Mount Sinai, we follow best practice, which means we've looked at all the requirements that you need for your prenatal care. And we've chosen what we consider to be the most important to get the most information, not too much, not too little, because there's so many tests. So when you come in, we'll take a history from you. We'll ask about prior pregnancies, prior deliveries, medical problems, surgical issues. So it's a pretty thorough history that we take. Then you'll be brought into the GYN evaluation room. And usually I start off with a transvaginal ultrasound because that's going to give me the most information about your pregnancy. A lot of times you get surprise twins. Sometimes you'll find that you have a little hematoma here or there. So the ultrasound is really going to help us also with dating. A lot of people are not sure of how far along they are, especially if you have an irregular cycle. So we will do a transvaginal ultrasound, which gives us the most information. And then if you need a pap smear or a vaginal culture, we'll also do that. And we'll do an exam just to see the anatomy, your anatomy. And then I usually walk through the schedule with the patient, and it's a lot of visits, prenatal care here, around 13 visits minimum, which is what we recommend. Just if you come in at 8 weeks, we usually see the patient around 13 times, maybe more, depending on if the patient's more complicated or not. And then we'll do a series of blood tests. Some of the tests that we do are pretty involved. Like we do a genetic testing, 283 recessive genes, just to see if you've been exposed to that, or if you are someone that has like a genetic issue that you didn't know about. So what we have is patients are a product of their parents' genes, right? Mother and father. But when they come into their prenatal visit, a lot of times they don't know anything about their history. So if someone, for example, has a sickle cell trait, we'll discover that in their prenatal care. A thalassemia, cystic fibrosis recessive traits. So we do genetic screening for those also at the initial prenatal visit. So your first visit is your pregnancy confirmation visit. At that time, we'll have a rough idea of how far along you are and when your due date is. And then we're gonna adjust your schedule based on what gestation you're at when you come in. If you're, for example, 5 weeks and you're having spotting and cramping, and we have yet to get a fetal heart, we'll have you come back the next week, and then we'll look for that fetal heart activity. And then after your first visit, which is 8 weeks, that 10 weeks, we'll do something called a non-invasive prenatal screen, which is a blood test. So when a patient's pregnant, let's say it's a normal pregnancy, we want to find out, do they have Down syndrome? Does the baby have trisomy 13/18 monosomy X? And these days, we also have the technology with the screening to tell if a patient wants to know the baby's gender. We will be able to give that to them usually at 10 weeks, 11 weeks. So that's kind of interesting. We do a nuchal translucency test at 12 weeks, which is an ultrasound. So one of the reasons I like this office is we can do the ultrasounds and then I can talk to them right away after. It's not like two separate offices. And that measures the thickness behind the baby's neck. If the thickness is greater than 2.5 centimeters, we're a little concerned. So we usually refer a patient for genetic counseling and further testing. But if it's less than 2.5, it's really reassuring. So the non-invasive prenatal screen coupled with the nuchal translucency together is 99% accurate screen for Down syndrome. At 16 weeks, we do an hour-long anatomy scan, mostly focusing on neural tube defects, which, for example, spina bifida. As a side note, in history, there were more babies born with spina bifida or open neural tube defects because food wasn't fortified with folic acid. Now, food is fortified with folic acid, so most people don't have defects in their neural tubes. But if you look back in time, babies were born with their spinal cord coming out of their neural tube because it didn't close properly, because they had a nutritional issue. So at 16 weeks, we're really looking for your spinal cord and the neural tube defect. We also do an amniotic fluid panel at that time just to make sure that you don't have any spillage of amniotic fluid into your blood, which would also be a risk factor for neural tube defect. At 20 weeks, we do an anatomy scan, mostly looking at cardiac anatomy, because you can assess cardiac anatomy best around 20 weeks. If we have any problems with that, we'll refer you for a fetal echo, see a fetal cardiologist. 24 weeks, I like to go over the delivery plan with the patient. And 24 weeks is also a good time because we know that that's a viability marker. And I also give a breast pump prescription to the patients at 24 weeks because most insurance plans will give you a breast pump. So I talk to them about breastfeeding and breast pump prescription. 28 weeks, we do a glucose test. I recommend a Tdap vaccine for the patient and her partner. 32 weeks, I do a growth scan. 35 weeks, I do a group B strep test. And then I see the patient every week at the end and plan for delivery. There are so many apps that offer so many different angles to look at. I would say that probably the best one, and this is coming from my patients because I had children when there were no pregnancy apps. Baby Center has a very good app. The one thing that we like about the Baby Center app is it gives you good advice about you physically, what's going on, the size of the baby, what to expect. The only problem I think with some of the apps is they get your information and then you'll get emails from them and advertisements from them, which can be good. I've asked patients, which apps they use, and a lot of my patients like the exercise apps. Juna Baby is a good exercise app because, pregnancy is a time where you have to, you're kind of in training and preparation for delivering a baby, right? With the goal of a healthy baby delivering vaginal or C-section, but you want to optimize your health. So Juna Baby is a really good app for patients. Baby Center has a great app, and it kind of, shows you where your baby is size-wise. 4 weeks, your baby's the size of a poppy seed. A lot of times my patients will come in and say, oh, today my baby's the size of a kumquat, which I think is cute. But those are the ones I recommend, but there's a whole host of them. But those are two good apps. I think the most important decision to make probably when you're choosing where to go for your prenatal care is you want to have a doctor that you can communicate with, that doesn't intimidate you, that really listens to your needs, that's flexible, because things change with your prenatal care. And so you don't want to feel like you can't talk to your OBGYN because it's a long relationship. It's 10 months, even longer, really. And that's just one baby. What if you have many? So, it's a big decision where you're going to have your baby because you want to be in a place where you'll have a safe delivery. In my opinion, I want everybody that's going to have a baby to be satisfied with their outcome and not traumatized. And I've been in women's medicine so long that, everyone remembers their delivery story and they remember their prenatal care. They remember everything. And so you want to have a really good relationship with your OBGYN and the hospital and all the different players, like the sonogram techs. Everybody should be, on the same page with each patient. And so I think each patient should feel special. The other thought is that I look at prenatal care as kind of like helping the patient learn about themselves and, learning about the problems they have, like possibly genetically. For example, if they are diagnosed with gestational diabetes, this could be something in their family. Even if they have an ideal diet, it may be something that we have to adjust to in pregnancy. So, just being open to realizing more about your health in pregnancy. A lot of people don't go to the doctor until they're pregnant. And then they're seeing us so frequently that we pick up a lot of, issues that patients never were aware of. But I think that's about it. Just when you're pregnant, it's really like you're training your body for pretty heavy duty work. I mean, being pregnant is not easy. There's a lot to it. There's a lot of steps. There's things you can do to optimize your pregnancy, stay as healthy as possible. Make sure you're eating a healthy diet. Make sure you're getting enough rest. It's the basic formula, but it's really hard to apply. But I think in general, if you find the right facility, if you find the right hospital, if you find the right doctor, I think you'll be fine.